Welcome back to Hometown Healthcare, where we are interested in perspectives and innovations in community healthcare. I'm Charlie Barnes IV, owner of Barnes Healthcare Services, also known as Barnes Drugstore in Valdosta, Georgia, my hometown. So I'm excited. We've been around, just if you forgot, we've been around for 111 years, fourth generation. So I had another thought today. Our vision as an organization is leading the transformation of healthcare. This is kind of a part two. The last time I spoke about myself, and I have another personal story about kind of ties into being a recovering sodaholic, which I was for many, many years. Teenager, early 20s. I was really, really bad. And I finally came off of that, lost 40 pounds. It was great. Felt so much better. Energy up, all these great things. Well, as time went on, working in an office, grinding every single day, working late hours, long hours, all those things that you can do in an office and trying to do good work. Sitting, I don't know if it's a combination of just bad posture, sitting in a desk, what it was, my back started to bother me. And one thing to note, I thought it was it's just kind of getting old kind of thing. And I played, and it was some old spots too. I played tennis growing up. I was competitive. So I was a fairly serious tennis player, and I had, I would hurt my back actually playing tennis a good bit, and I'd have to stretch and roll and do all these things. And it felt similar. I'm like, yeah, is this just, old age? And this is kind of reoccurring back from when I was younger. It's kind of catching up to me. Maybe I beat up my body a little bit and it's catching up to me. But anyway, it was getting bad, and I probably put it off for a couple of years, and then I decided to go to the chiropractor and did that. I went to 2 different chiropractors. I wasn't satisfied. We did some skeletal, x-rays, and we did some infrared x-rays depending on which chiropractor, and they did some stuff, and I was like, I'm just not getting the results I want. Now, granted, I only went once. I'm not saying anything bad about chiropractors by any means. I'm actually a big fan, but I'm just like, I just don't see this doing what I'm really looking for, and the results I'm looking for to eliminate this back pain. It just didn't seem to connect to be the right thing. And luckily I had the initiative around that time to start playing tennis again. Now, granted, I hadn't played in 10, 15 years, and I just get back and get some exercise. I was also thinking that I need to exercise because it helped my brain work a little better. If you know that, if you don't exercise, your brain doesn't work as well. So I was like, I need more brain power. I'm just not that good without it. I need a higher level of brain capacity anyway. So I went back, started playing tennis, and it wasn't probably 60 days after doing that, playing once, twice a week, usually twice a week is what I was doing, that my back pain started to really fade away. I had been doing another thing that's probably about a few months before I started playing tennis, which helped a lot too, which is like a hard foam roller, and using that to roll my back and try to loosen it up and space it out and make it feel better. And that helped a little bit, but it just wasn't getting it there. But when I did the tennis, it really made the difference. Actually, my back pain completely went away after probably 90 days, 60 to 90 days, and I felt great. And I wasn't not doing a ton of exercise. I wasn't even doing the recommended exercises, which is like 45 minutes a day, or getting your heart racing, at least 4 times a week, 15 minutes. Get your heart racing like 4 times a week. That's kind of a standard that you hear. That's a good exercise. At least do that, as a minimum. I don't know if I was quite doing that because I was playing probably, an hour and 20 minutes at most, 2 times a week. But it really helped. You know why? I figured out it's that whole thing. We hear it a lot. It's like strengthen your core, strengthen your core. And that's what I was doing. I was really just strengthening my core. It made the back pain go away. And interestingly enough, to verify that, my father has had back pain for a long time as well. And he's done a lot of things. He's been through and helped it. They were wanting to have surgery on him. They were wanting to give him all kinds of pain medications and all this stuff. And he went through a long process of massages and chiropractic and in kind of an integrative medicine, more holistic kind of field. And he got so much better from doing that. But it's like he literally couldn't walk. I mean, he was getting pretty bad. And but he got to a certain point and he felt good, but he still hurt a little bit. But he was mobile. He felt better. Had lost weight, all these things. And then he still hurt a little bit. And then he started doing his workout every single morning. Actually, he did it 7 days a week, 2 days, at least an hour a day. And his back pain, he never felt better. And I don't think he can remember when. eliminate that back pain. It's strengthening the core. So I just wanted to give that tidbit on a lifestyle change that worked for me. It also worked for my father. So there's a little bit more evidence there, and everyone knows or has heard strengthen your core. Well, that's it. So whatever it is that you like to do, for me, tennis really helped out. For him, he's doing the push-ups and doing some different exercises with weights and just some normal activities on that. And whatever it is, strengthen your core. If you have back pain, I think that'll help. I think that's the number one thing. You don't need medications. You don't need surgery. You need to work with a doctor. You need to work with the right doctor. You need to look a holistic approach. But I think that's a big part of the recipe right there is strengthening the core. So with that, thank you for joining me today, and look forward to talking to you again here on Hometown Healthcare.